Our next topic is sleep strategies. How you sleep can have a profound effect on your mental health, and we're going to hear all about it from Dr. Lisa of Apothecary of Morden. Lisa Zaretzky is a doctor of pharmacy and owner of Apothecary of Morden. She has been practicing in the field of pharmacy for 25 years now, and a pharmacy owner here in Morden over 15 years. Dr. Lisa's new location on Stephen Street has brought Morden some exciting and much needed services, with an expansion to include a flotation tank for pain and stress management, a private chair massage area, personalized skin analysis, and 2 private pharmacy consultation rooms. Dr. Lisa provides many one-on-one patient services covering health concerns like management for pain, stress, and anxiety, and comprehensive medication analysis. She is also certified in travel health and palliative care. Dr. Lisa, we're looking forward to your presentation on sleep strategies. If you have questions, we will take some time at the end for some discussions, so please put your questions in the comments or email mentalhealthweek@mymorden.ca. Dr. Lisa, take it away.
Well, thank you for that introduction, Stephanie, and great information just prior to me about children and anxiety. It's a bit of a segue talking about sleep as well. Okay, I'm just going to get my slides set up here. Okay, sleep strategies. Sleep is so very much important part of our day and of our night. And sometimes we struggle with how to identify sleeping problems. So let's start with that. Like, what kind of trouble does sleeping give us? Often we talk about sleeplessness and insomnia as if they're interchangeable, but they're not really. Because sleeplessness, although it can be a huge problem in someone's life, isn't as serious as true insomnia. So sleeplessness is quite common in our environment, and it can often be treated with self-care and lifestyle management. True insomnia is less common, and we'll talk about what defines true insomnia with the next slide. And true insomnia certainly can require assisted intervention, either from your healthcare practitioner or even a naturopathic doctor. So what really defines insomnia? Well, it's a bit multiple definition here, but it certainly starts with not getting enough sleep on at least 3 nights per week for at least 3 months. So it's quite specific. And it should also include trouble with daytime impairment, not thinking clearly, and not ever really feeling rested when you wake up. It could also include taking more than 30 minutes to fall asleep on those nights that you're having trouble, or waking up during the night and staying awake for at least 30 minutes or more before you're able to fall asleep again. And it certainly includes a chronic worry about lack of sleep. So it's quite multiple faceted defining insomnia. And this is important because we want to treat insomnia a little more rigorously than occasional sleeplessness. So how do you know if you have insomnia? Well, aside from those definitions on the previous slide, it's really helpful to evaluate a 24-hour sleep and wakefulness cycle or patterns. Sometimes a home sleep study is an effective way to do this. Often a practitioner will give you a diary to keep track of your sleeping patterns for a couple of weeks. And this can give you some objective information to share with your practitioner. It's sometimes helpful to interview your sleeping partner or your bed partner if you have one, because you might feel like you've been awake for an hour, but really it might only be a few minutes, and they can sometimes give you a clue for that. Family history is also an important part of the picture because sleep disorders can run in the family. So what causes insomnia? Well, there's some real primary causes of difficulties with sleeping. And one of them is, of course, breathing disorder, like apnea. You've heard of sleep apnea and different types of breathing problems while you sleep. Narcolepsy is also a common problem, or cause of insomnia. Sleeping on and off all day long can then lead to not being able to sleep at the proper nighttime. Circadian rhythm and sleep-wake disorders like jet lag is quite common. In our area, there's often a lot of shift workers that have a real trouble falling to sleep when it's their time to sleep. There's a condition when you sleep that you can move abnormally, and that's while you're dreaming. So you're kind of trying to bring your dreams to life, which is a little bit different than restless leg syndrome because movements of your legs can happen without dreaming. So all of these points or conditions on this slide can be the real reason why you're not sleeping. But often it's a bit more complicated than that because there could be a lot more other causes of insomnia. That's not really the primary cause, rather a secondary cause from other illnesses or conditions. Of course, other lung or pulmonary diseases, again, related to breathing or trouble breathing during your sleeping. Diabetes, cancer, rheumatic diseases. Of course, the main cause of sleeplessness there would be pain and waking up from pain during the night. Just like fibromyalgia would also cause difficulty sleeping because of frequent pain episodes. Heart disease, including high blood pressure or hypertension. Hyperthyroidism, which of course is a hyper or overactive thyroid, can cause disturbances in the sleep. Urinary incontinence, reflux, pregnancy, the discomfort of enlarged body while you're pregnant can cause many troubles during sleep, as well as hormone fluctuations during pregnancy and during menopause. Lyme disease, HIV, chronic fatigue, itchy skin. Itchy skin is by far a very common condition that can lead to sleeplessness or insomnia. And sometimes if we can just appropriately treat the itchy skin, we can actually avoid having to use sleeping medications. Kidney disease is also a common cause of insomnia. And probably one that we all are very aware of is depression, anxiety, and PTSD, as well as substance use disorders. So with any of these secondary causes, we don't necessarily want to treat insomnia directly if you're found to have one of these illnesses. Rather, we want to make sure that the secondary causes are better treated. So we want to focus on the illnesses and treat the illnesses correctly and to see if the insomnia would resolve. So what other things can lead to insomnia or sleeplessness? Well, these are things that we may be able to change or modify, like our behaviors. Too much screen time. The previous speaker spoke about screen time, but in this case, the screen time can change our body's normal responses to light and darkness. So if we have a lot of screen time prior to bedtime, our melatonin levels are not the same, and it could cause us to feel more alert than we'd like to. But even lately with the social distancing and physical distancing, we're spending a lot more time online and on our screens. So even more than normal daytime use of computer and screens can lead to problems of sleeping at nighttime. Of course, it's very good to be active all day long and to have a good physical activity routine. But energizing on physical activities prior to bedtime actually can stimulate you and not help you have a good sleep. Going to bed too early can be a problem with sleep. Eating too much and too close to bedtime is also a very big problem for a good sleep. Some environmental causes of insomnia or sleeplessness would be the room conditions, like too much light in the room, too much noise in the room, maybe background noises or a partner snoring. the room being too hot or too cold, and of course, the comfort in the bed. Make sure you got a good bed. So all these things we actually can change and adjust to help our sleeping problems. Of course, there's some other life issues that can lead to insomnia, and that would be young children not sleeping through the night and parents never getting a good night's sleep. Snoring partners, very big problem with couples. And of course, lately it's experiencing this pandemic that we're in, and all of the complications with this new way of living that we are now having to deal with. There's also a lot of medications that can cause insomnia. And it's important to know the medications that you're on before you kind of attack or have some clues to help to treat sleeplessness or insomnia. For example, stimulants. Caffeine is a stimulant we're very aware of, and it's found in not only coffee and tea, chocolate, and some carbonated beverages. So it's important if we want to drink these caffeinated beverages or foods that we enjoy them in the morning or early afternoon so that the caffeine is well out of our system before bedtime. Another source of caffeine that's important to remember is in some headache medications, or Tylenol 1, 2, or 3, all have some caffeine in it. Depressants like alcohol actually can make us feel a little drowsy when we drink them, but later as our body metabolizes the alcohol, something called sugar alcohols goes into the bloodstream and actually can disturb our sleep quite a bit and cause us to be much more awake or restless during the night. Medications for the heart called beta blockers can disturb our sleeps. Many antidepressants actually can cause sleeplessness or lead to insomnia. Diuretics or water pills, if taken too close to bedtime, could cause you to be awake just by having to go trips to the washroom. Steroids like prednisone and dexamethasone are common problems for sleeplessness. Prednisone is a medication used for severe allergy symptoms or autoimmune disorders. And dexamethasone is sometimes used to treat nausea during chemotherapy, or even some dental procedures you need to take dexamethasone for. Sleeplessness can also be a result of withdrawing from medications. Medications that you maybe have been addicted to or withdrawing from, and this can cause quite a bit of disruption for your sleep, especially if narcotics were involved. So what are the risks that are associated with the lack of sleep? Well, a huge risk is increases in our hunger and appetite. And this is a direct result from changes in certain hormones in our body. So if you're a science geek, you might be interested in researching leptin or other hormones that change our hunger and appetite. It can also increase our blood pressure and change something called C-reactive protein in our body, which is a good prediction for heart disease. And it can also, lack of sleep can also increase the prevalence or occurrence of diabetes and lead to impaired glucose tolerance. So when we talk about treatment for insomnia or sleeplessness, the first thing we should talk about is what you should do more. So this is a good list, what to do. So do discuss your worries and stressful events prior to bedtime, not just before bed or while in bed. And do use relaxation techniques to help put yourself into the zone for sleeping. Have a warm bath, read a book before bed, or do some meditation or storytelling, or even listening to someone tell you a story. Do have reasonable sleep expectations. Sometimes part of our trouble with our sleep is what we expect. If we hear you should have 8 hours of sleep, we think, oh, wow, we're only getting 6, something must be wrong. So it's good to have predictable sleep and wake times. So plan when you're going to sleep and when you're going to wake up. But if you just can't fall asleep at the time you go to bed, well, just get up, walk around, do something, and try again later. And sleep only long enough to feel rested. Don't worry about how many hours it is. If you feel rested, get up and start your day. Do have a tolerance for occasional sleeplessness. It's okay to have a bad night's sleep now and then. It's only if it becomes a repeated habit month after month that would then need addressing. And do adjust your bedroom temperature, your lighting and bedding for comfort. Maximize all the environmental things that you can. And do use the bedroom for sleep and intimacy only. Do increase exposure to natural light during the day, and this will help set up natural melatonin levels for nighttime. The lifestyle: do not smoke before bed. Smoking includes nicotine, and nicotine is a stimulant, so do not smoke before bedtime. And do not go to bed before getting tired. Part of the problem with sleeplessness is lying in bed and worrying about when will I ever fall asleep. Do not take naps during the day. If you have too much sleep during the day, that could really disrupt your nighttime ability to fall asleep. Do not watch a clock or your phone in the night. If you wake up in the night or as you're falling asleep, try to avoid looking at a clock or your phone. Do not eat heavy meals before bed. So if you've tried all the lifestyle modifications and you still are not getting enough relief, enough good sleeps, then sometimes prescriptions are an option for you. But first, we need to find out what is the problem. Is it the primary problem or a secondary problem? So if you have apnea, the first treatment would be for the sleep apnea, or for the narcolepsy, or for the restless legs. We wouldn't first treat you for the insomnia. We first have to fix the primary problem. Or if it's a secondary cause, like the depression we were talking about, anxiety, or undermanaged other chronic illnesses, we want to make sure those are well managed first before we focus in on treating the insomnia directly. But we do have prescription medications for insomnia, and some of these might be familiar to you. The Z drugs, Zopiclone, Zolpidem, Trazodone is a different one, amitriptyline, nortriptyline. These may be familiar sounding to you. If not, just so you know, they're all medications that are used for sleep and sometimes other things, but they certainly can be helpful for putting you to sleep when you have trouble with sleeping in spite of all the other efforts that you put into place. Although they are very effective sleeping medications, they're not meant to be used every day for long periods. It's a good idea to get back on track with other lifestyle modifications that you can make and only use the sleeping medications short term for as few days as possible. But other good options beside prescription medications are supplements and botanicals. Some of these you may have heard of before, like lemon balm, B vitamins, melatonin, L-theanine, valerian root, hops, passion flower, chamomile, and even cannabis with THC can be helpful. The THC is better than just CBD alone. These medications can be found on their own, or they often are in combination with each other to help maximize the sleep potential. Of course, if you're really having trouble identifying what the problem is for your sleeplessness or insomnia, it might be helpful to be referred to a sleep specialist if necessary during a home sleep study. A company that we have here in Manitoba is called Cerebral Health, and they offer both specialist and home sleep studies. Because at the end of the day, we all really do need our beauty sleep. And does anyone have any questions?
Great. Thank you so much for that presentation. That's very important to think about how we're sleeping and what we can do to improve our sleep. So a couple questions for you. And if anyone else has questions, please email them to mentalhealthweek@mymorden.ca or comment on the video. So here's one question. I've been taking gravel for a few months now to help me sleep. Is that safe?
Gravel is a popular thing in the over-the-counter section of pharmacies that often people go to for sleeping medication. Although gravel can make you drowsy, it is not a good thing to use regularly because it can cause a whole lot of other really bad side effects, especially if used long term. So there ought to be other suggestions in that case.
That's helpful for sure. Since supplements are just herbs, are they all safe to use if I'm pregnant?
Absolutely not. It is a misnomer out there that if something is grown in the ground, you can take it as much as you want. But especially during pregnancy, it's really important to look at each individual substance and to be sure it doesn't have a risk for the unborn baby and to the mother herself. So there's actually very few things you can take safely in the supplement section while you're pregnant.
That's good to know. Yeah, you often do see that on the labels there, and always good to check. Another one here. I've been on a sleeping pill for years and want to stop it. Can I do that?
You can stop sleeping medications, and it's a good idea, especially if you have been on them for years. But you can't do it cold turkey. You have to do it slowly over time. And depending on what the sleeping medication is, it might take you weeks or months to get off of. It can be done, but it should be done with supervision and very slowly.
Very good. Do I need a doctor's referral for a sleep study?
No, you don't. The company Cerebral Health that I mentioned a few minutes ago, actually, you can purchase a home sleep study directly through them.
That's really awesome. That's something to take note of if anyone wants to check that out. Another one here. I have always only slept 5 hours a night and feel rested with this amount of sleep, but my mother says that's not enough. Is she right?
Well, in this case, I would say no, mother is wrong in this case, because everyone needs a different amount of sleep. And as I said in my presentation, if you feel rested after, let's say, 5 hours of sleep or 6 hours of sleep, then that's really all you need. There isn't the magic number or number of hours of sleep for everybody. It's very personalized.
That's awesome. Yeah, there's apps that show you how much you've slept, and I know I sometimes use it too, and I'm like, oh, we've got to get that 8. What do you think about apps that detect your sleep and how much you're sleeping?
I think they could be useful as a guide, but I think we could get too fixated on the number every night and worry about the number rather than how we feel. I think feeling rested and feeling productive during the day and without having trouble thinking during the day, that would be a more important indicator, I feel.
Yeah, that makes sense. Yeah, another thing. Oh, I do have a question here. Do you happen to know where I can find resources in Alberta for sleep studies?
I don't know Alberta branded resources, but this company I mentioned here in Manitoba, Cerebral Health, ships their sleep studies anywhere. So I would think if you contacted them, that would be useful. But I do know that there are sleep specialists in Alberta. If you want to contact me directly, like whoever asked the question, I could maybe do some research and give them some, Alberta branded names.
For sure. That's great. And that's good to know that that company ships beyond Manitoba. That's really good. And yeah, feel free to contact Dr. Lisa directly. We did post the link to Apothecary of Morden and also their Facebook page. So you can get contact info there. Yes, and anyone else, if you have questions, please email mentalhealthweek@mymorden.ca or comment on the Facebook page. Yeah, sleep is so important. Another question I have is there a certain pillow that is best for sleeping?
Well, again, that would be a very personalized response. I think whatever kind of pillow you like to use, whatever you feel comfortable, unless you have some neck problems, I think whatever makes you feel the most comfortable. Sometimes people even sleep without a pillow, which can be perfect. I mean, if you have different sleeping disorders, then elevation is pretty important part of a good sleep. But otherwise, no, there's no magic pillow.
Oh, shoot, I was hoping for one. Well, that is great. And you can touch base with Apothecary of Morden directly through their website or Facebook page. They have lots going on there. While we have a couple minutes here, can you tell us more about flotation therapy that you have at your apothecary?
Oh, sure. Which it can tie into helping with a good sleep as well. So flotation therapy is another way of describing sensory deprivation tank. It was popular in the 70s in different parts of the world, and it kind of regained some popularity lately as we're looking for ways of managing pain and anxiety that are non-pharmacological. So in a sensory deprivation tank, there is no light and no sound, and you're lying in a body of water about 11 inches high, and the temperature of the water is the same temperature as your skin. So when you're lying in there, you really can't tell when your skin ends and the water begins. So it feels like you just your head floating in space. And with no distractions, like no sensory distractions, your mind is allowed to go to places that you wouldn't otherwise visit. And it often just wanders from here to there in sort of a meditative state. So this helps your mind with stress and anxiety and helps for relaxation of your mind, but also the magnesium that's in the water, which is a big part of the flotation. So it's super saturated with magnesium sulfate, which helps you float without any effort. The magnesium can absorb into the skin and help relax your muscles. And just the effortless floating is huge relaxation for your muscles and your nerves.
Wow, that sounds like an amazing experience. How has COVID-19 and precautions around that affected that? And do you anticipate opening that service up at some point?
You know, it is an activity that is done all alone without any people around. So we do offer flotation services now. We have 4 different levels of disinfecting for the tank, so it is a very safe environment to be in. As for the rest of the store, well, it's certainly has affected us greatly in how we manage our interactions with patients. I feel so naked right now, not having a mask on and talking to people. It's certainly wearing masks and other PPE has been a big part of our day-to-day practice. But we are still able to help people, and we don't want people to stop coming in, and we can connect virtually like what you have helped us with here. And I can also do that one-on-one with patients through my own, technical links that I have. So, we want everyone to stay as healthy as possible and as safe as possible. And I think we can do both.
That's awesome. And that's great to hear that flotation is still happening. And that's right. You just are able to clean that thoroughly, and then that is pretty safe to use. So if anyone's interested, you can check that out. Are there any other services at Apothecary of Morden you'd like to highlight?
Well, with this week's announcement of phase one of reintroducing some services, we do have the naturopathic doctor coming back in to offer her appointment-based services. We have an Ayurvedic practitioner who focuses on whole health and very personalized health counseling. So that is coming back very soon as well. And part of my personal practice is travel health. And with travel health involves a lot of vaccinations. And with all of us waiting very anxiously for a COVID-19 vaccine, there are a lot of other vaccinations that we ought to be vigilant with. And it's important for everyone to look into their own history to see if they're up to date on all the vaccines we do still have available. So I'm focused on that and helping people make sure that they have all the vaccinations they should have, because this one vaccine we all know is very important, but there's at least 20 others that are equally as important. Measles is one of them. Pneumonia is another. You know, we need to focus on getting the ones we have available to us.
That makes a lot of sense, and that's certainly something we should look into. So that's some homework for us. Check in if your vaccines are up to date, and try and have a calm evening so that you can get into a restful sleep. I think that is where we will leave it for now. Any other questions? I think that is all we've had come through at the moment, but please feel free to continue asking questions by reaching out directly to Apothecary of Morden or commenting later. We'll try and pass it on. Thank you so much, Dr. Lisa, for sharing with us on this topic. I am sure the information will help us all to sleep better tonight. We just need to put it into practice.